Even after they battled the cancer, the fear of reoccurrence lives on for many survivors. Kim Kaiser spoke with a health psychologist at Essentia who helps patients work through their feelings of fear.
Susan Bruns, a psychologist at Essentia Health, works with patients one-on-one and speaks to groups about dealing with the emotions surrounding cancer.
The cancer word, just in and of itself, just evokes powerful emotions for people.
And when it's a cancer diagnosis, those feelings can run even deeper. Judy Barber, a breast cancer survivor, understands firsthand.
I think probably everybody goes through, and I went through or have still going through. Every little pain might be a reoccurrence somewhere else or the same area. It's a fear.
The importance of facing those fears was a message Susan delivered to Judy and other cancer survivors at the recent conference the Essentia Health Cancer Center held at the deck. She says ignoring those feelings isn't the answer.
Emotions are physical, emotions are chemical, unexpressed emotions don't go away, they show up in our bodies.
Instead, by acknowledging the all too common fear of recurrence, patients can tap into the part of the self that serves as a witness to those fears.
The part of me that can bring an awareness to what my feelings are so that I'm not so caught up in them. So I can actually do what's a mental noting of my feelings so that they don't have to take on a life of their own.
And by doing that, Susan says, patients can help stop the feedback loop of fear.
The feedback loop of fear is that it keeps just going around and around and around, and when it does that, it's hard to believe or convince yourself that whatever it is that I was afraid of may not possibly happen.
Susan also discusses the benefits of relaxation techniques, like the Qigong seminar that was offered down the hall at the conference. Qigong is a type of energy meditation. Susan took a few minutes to participate in the guided meditation herself. She says reminding yourself to do something as simple as taking deep, fulfilling breaths can help patients come to terms with their emotions.
The tip about that is to be aware of it and to remind yourself more than once in a day to breathe and to breathe fully. And so there's some ways to just do that. Diaphragmatic breathing, allowing your air to come in deep, the belly comes out, relax, that type of thing.
It all begins, Susan says, with acknowledging, not avoiding your feelings.
We can't do anything different if we're not aware of it. So tuning in to yourself, being able to be mindfully present to yourself, and having an awareness of what's there.
For Healthy Living, I'm Kim Kaiser.
Some wonderful advice for all of us. Well, Susan recommends talking to your doctor about resources for counseling or support groups. You can also discuss your feelings with a chaplain, social worker, or a psychologist. And coming up, we'll talk to two patients with interesting perspectives on survivorship, plus a look at the lifestyle choices that can help stop cancer from coming back or prevent it in the first place. We'll be right back.